Hi, welcome back to Move 365. I'm going to answer a question that lots of people have about core stability. How do you engage your core, the core? Is there any such thing as the core? Well, when people talk about the core, often they're talking about your abdominal muscles. And there seems to be quite a lot of differing opinion on how to go about engaging those muscles in different positions of exercise or movement. I like to try to simplify it down as far as possible. I talk about abdominal bracing, and when I talk about abdominal bracing, I'm really talking about taking all of the layers of wraparound abdominal muscles, so the transverse abdominis, the internal and external obliques, and getting them all to fire up at the same time. The reason for that is that the fibers in those muscles go in different directions, and a little bit like the weave of carbon fiber that can be interwoven in different ways to essentially give stiffness, rigidity to that structure, rather than the grains of a piece of wood that tend to go in the same direction broadly, which allows flexibility in the tissue. Crossing the fibers at different angles and stiffening them provides rigidity. And that's what we're talking about when we talk about core stability. We want to be able to engage our muscles in such a way that the lumbar spine won't move out of the position that it was in when you engaged those muscles. And of course, the optimum position for your lumbar spine to bear load is your neutral. We know that the pressure on the discs, the loading on the discs and the other soft tissues in your lumbar spine, as well as the bones themselves, is optimal when your spine is in neutral. So my neutral is this little hollow shape, not too flexed, neither too extended, but somewhere in the middle. And I'm going to engage my abdominal muscles around that shape. So how do I do it? Some people think that you should suck in, that it's a sort of process of pulling in and up. It isn't. The way to do it is to use a technique a bit like you would use if you were going to clean a pair of glasses and you wanted to fog the lens. If you put your fingers, 2 fingers or a thumb, and just put them just into your side, just above that little bony lump on the front of your pelvis, just above there, about sort of 4 or 5 centimeters sideways from your belly button. And if you cough, you'll feel the muscle pushing out against your fingers. If you pretend or actually have a pair of glasses that you can fog, you'll feel the same thing. The muscle pushes out against your fingers. And what you're doing there is you're engaging all of those 3 layers of abdominal muscle all at once. So what you have to practice is being able to engage them and hold them stiff. It's what would happen if somebody said, I'm going to punch you in the stomach, brace yourself. You would do the same thing. You would push your abdominal wall essentially out into a stiff position, stiff defensive position. But because of where those muscles attach, that gives you that wraparound corset of stiffness, stability. So if your idea of engaging abdominal muscle has anything to do with sucking in, drawing in, pulling in towards pulling your belly button in towards your spine, no. If your idea of engaging your core starts with, and this includes lying down, particularly lying down, starts with imprinting your spine on the floor, no. What you're doing by taking yourself out of your neutral position is increasing stress on some tissue in your back somewhere. We're not about the business of increasing stress on your spine. We're about the business of moving in a way that is as stressless for your spine, risking less injury or putting you at the least possible risk of injury as you move. So find your neutral, somewhere between flexion or extension of your lumbar spine. Use pain as your guide. Find the most comfortable position and start to practice fogging your glasses, either literally or metaphorically, to engage those abdominal muscles. Feel the increased tone, the stiffening of those muscles. Practice being able to breathe in and out, holding those muscles with a degree of stiffness. How hard do you have to tighten them? Not as hard as you possibly can, because you won't be able to breathe. You only need 5 to 10% of the maximum power that you could generate in those muscles to have a positive effect on the stabilization of your spine. So it's simple. It's just about bracing to 5 or 10% of the maximum power that you've got. But you've got to be able to breathe in and breathe out whilst holding that contraction. And then once you're done with it, you can let it go. Have a practice? Please comment below. I know this is a potentially little contentious issue, so I'd love to have a commentary with anybody about it. And please like and subscribe. And remember, always remember, life's better when you're moving.